Hi viewers, welcome back. Today we are going to see an interesting topic, Evans syndrome. What is Evans syndrome? It is a very rare autoimmune disease in which the body's immune system destroys the red blood cells, white blood cells and or platelets. It is a rare combination of one or more autoimmune disorders which may include autoimmune hemolytic anemia, autoimmune thrombocytopenia and autoimmune neutropenia. In autoimmune hemolytic anemia, the immune system destroys the red blood cells which carries oxygen to the body organs and the tissues, whereas in thrombocytopenia, the immune system destroys the platelets which stops bleeding by forming clots. In autoimmune neutropenia, the immune system destroys the neutrophils which decreases the body immune function, so there are more chances of getting infection for the individual. The signs and symptoms of Evans syndrome depend on which cell is affected. In case if the RBCs are affected, there will be weakness and fatigue, paleness or jaundice, shortness of breath, lightheadedness and palpitations. In conditions where the platelets are affected, there is increased chances of bruising, prolonged nasal bleeding, increased bleeding from small cut wounds, petechiae, that is tiny purple or red spots on the skin. Purpuras are also seen, which are nothing but the purple spots on the skin which appear raised. There may be ecchymosis, that is large purple blotches on the skin. In case of white blood cells affected, there are more chances of infection, fever, oral ulcers, feeling unwell or sick. It is also found that people who have autoimmune hemolytic anemia has thrombocytopenia and hence the Evans syndrome percentage is from 7.8% to 23%. Even though it is an autoimmune disorder, the cause is unknown, but the loss of self tolerance is postulated. Autoantibodies targeted at different antigenic determinants on the red blood cells and the platelets are assumed to cause isolated episodes of hemolytic anemia and thrombocytopenia, respectively. Blood tests are done to rule out thrombocytopenic purpura, hemolytic anemia, and direct antiglobulin test and the absence of any underlying causes. In 27% to 50% of cases, there is an association of malignancies or predisposing autoimmune disorders like sickle cell anemia. This is also called as secondary Evans syndrome. So, a complete blood investigation which measures the patient's immune system is done. A direct or indirect Coombs test which looks for antibodies against the red blood cells are done. A bone marrow aspiration can be performed. CT scans of chest, abdomen and pelvis can be done. Doctor may diagnose when the patient presents with AIHA and ITP, even if there are no symptoms of Evans syndrome. Coming to the management part, corticosteroids play a major role. It helps to lower the activities of the immune system. The side effects of corticosteroids include increase in the blood sugar levels, increase in the blood pressure levels, mood swings, and weight gain. There are also intravenous administration of immunoglobulin. They are nothing but solutions that contain antibodies from healthy donors. Next comes the use of immunosuppressive drugs. They work by reducing the immunity level. The complications include frequent infections and illnesses. Rituximab is a newer drug that reduces many side effects due to the immunosuppressive drugs. The NOR says that rituximab is very effective in treatment of Evans syndrome. Spleen removal is a major surgical procedure done in which the spleen of the patient is removed, which also possesses lots of complications. The risk of splenectomy outweighs the benefits as newer drugs like rituximab is available. Then comes hemopoietic cell transplantation. Here, a stem cell transplant could help reset the immune system of the client. The treatment requires a donor to provide stem cell who is usually a close family member to the patient. The prognosis of Evans syndrome varies with patients. Many may have periods of long remissions in which the signs and symptoms may disappear or reduce. Others may also have chronic problems with no remissions. Rarely they do well without treatment. The recurrence of anemia and thrombocytopenia are very common. These Evans syndrome patients are also having more chances to get autoimmune disorders as SLE. Hope this video was informative. Thanks for watching and subscribe for more videos.